Hello everyone. This video is a part 2 continuation about radius. Muscle attachments of the radius bone. Biceps brachii. Biceps brachii inserts into the rough posterior part of the radial tuberosity. Supinator. Supinator muscle inserts into the upper part of the lateral surface of the radius. Pronator teres muscle inserts into the middle of the lateral surface of the radius. Brachioradialis muscle inserts into the lowest part of the lateral surface of the radius, just above the styloid process. Radial head of the flexor digitorum superficialis muscle originates from the anterior oblique line and the upper part of the anterior border of the radius. Flexor pollicis longus muscle originates from the upper two-thirds of the anterior surface of the radius. Pronator quadratus muscle inserts into the lower part of the anterior surface and into the triangular area on the medial side of the lateral end of the radius. Abductor pollicis longus muscle arises from the middle one-third of the posterior surface of the radius. Extensor pollicis brevis muscle arises from the lower part of the posterior surface of the radius. Capsular attachments of the radius. Fibrous capsule of the elbow joint attaches to the annular ligament of the radius and margins just under the head of the radius. Fibrous capsule of the wrist joint attaches all around the margins of the articular surfaces of the lower end of the radius. Ligament attachments. Annular ligament is a strong fibro-osseous circular structure that encircles the head of the radius. Interosseous membrane, a fibrous sheath that connects the interosseous margins of the radius. Palmar radiocarpal ligament of the wrist attaches to the thick ridge on the anterior surface of the distal radius. Articular disc of the inferior radio-ulnar joint attaches at the lower margin of the ulnar notch. Radial collateral ligament of the wrist joint attaches at the tip of the styloid process of the radius. Dorsal radiocarpal ligament, it is also known as the radiotriquetral or radiolunotriquetral ligament. Dorsal radiocarpal ligament attaches at the dorsal radial edge of the distal radius, from the level of the Lister's tubercle to the sigmoid notch of the distal radius. Clinical anatomy. Fracture of the radius are more common than ulna, caused by falling onto an outstretched hand. Some common fractures of radius are Colles fracture, Smith's fracture, Schoeffer's fracture.